Hello everybody, this is Dr. Aaron Seaton doing another video. Today's video is strength training or cardio. Which one should you do? And the answer is coming at the end. How about? So what we typically see are certain benefits that come with these different styles of training. And with strength training, obviously we typically see an increase in our muscle mass. This will help with building bone density and also retaining our bone density as we get older, because muscles pull on bone when you lift stuff, and when you do that you stimulate the bone to make more bone. So hanging on to bone density and hanging on to muscle mass, these are very good things as we age. Other things that we see with men and women, we see this improvement in testosterone levels, especially for men getting older, because lifting weights is what's called an anabolic process, right? Your body is lifting stuff that stimulates the building of muscle, and we need hormones like testosterone to do that. The other thing that I've noticed too in my practice specific to chiropractic is that proper strength training can improve your posture. Because you're stimulating the muscles, especially the muscles in the back, your core muscles, you're stimulating these muscles to fire and to be used, and that tends to improve our posture because those muscles are now working more. This is really good with patients that have hypermobility issues, meaning their joints move too much. Patients with scoliosis fit in that bracket. Other patients with other hypermobility issues, strength training can be very effective for them in preventing flare-ups and pain. So this is a very important form of training. The other form of training that we have out there is cardio. And what are the good things about cardio? Well, with cardiovascular training, we get improvement in our VO2 max, our lungs' ability to bring in oxygen, which is very important, especially for our older patients. They've actually studied this, and if you have a higher VO2 max as you get older, you are far less susceptible to lung infections, pneumonia, the flu, and as you get older, that can kill you. So having a higher VO2 max can help prevent those bad infections from worsening. This is also very good for your heart. That's a no-brainer. We know getting cardiovascular exercise, fast-paced walking, running, doing the bike, whatever it is, swimming, these are all great forms of cardiovascular exercise that we know is very, very good for the heart. The other thing that it does is it increases our capillary density. And what that means is you have blood vessels that eventually turn into these small little blood vessels called capillaries, and that's where your cardiovascular system delivers the oxygen and nutrients to those cells and then removes CO2 and takes it back to the lungs. So whenever you increase capillary density, you are more efficient at bringing oxygen and nutrition to your cells. So this is a really, really good thing. So what is the answer? Which one do we do? Well, the answer is pretty simple. You want to do both. Doing both can help, and cardio can help strength training, just like strength training can help your cardio. The two go hand in hand. There really shouldn't be a battle between, oh, you should only do this or you should only do that. You really should find a balance between the two. At my age, at 42 years old, I have found that when I'm strength training, I want to focus on good quality form. I don't want to get too carried away with heavy lifting. I want to lift heavier weights, but I don't want to get carried away with it. I tend to stay in that 8 to 12 rep range, sometimes 12 to 15 rep range, and I'm really focused on my form when I do this. That's more important at age 42 than bragging about some crazy amount of weight that I lifted and hurting for the next 5 days. The cardio that I tend to like to do is more of a steady state cardio. I will throw in some sprints here and there because I think that's good for us. But I'm not doing a ton of higher impact training at this age, just because as we get older, our joints can't take that as much, and that can cause more damage than it's worth. So hopefully, if you're looking at training, you look at doing a combination of both of these things together, because the two together, in my opinion, are the best bet for your health. I'm Dr. Aaron Seaton with the Chiropractic Place.